So before this, I would wash my hands to make sure they're sterile. And we don't have gloves, but I would wear those for the assessment. We don't have gowns, but I would use that in the assessment too. Hi, my name's Tristan. I'm going to be your nurse today. Can you confirm your name and date of birth for me, please?
My name is David Straub, and I was born in April 13th, 1999.
Nice to meet you, David. So today I'm performing an assessment over your thorax, your abdomen on both the anterior side, which is the front, and the posterior side, which is the back. I'm also going to be checking your breathing for you. So now I'm going to close the curtain so we can have privacy. And then, have you ever had asthma, like been diagnosed with asthma?
I have not, no.
Have you ever had pneumonia?
I have not, no.
It's lucky.
Thank you.
So can you take off your shirt for me, please?
Yes, okay.
So I'm going to be checking like how you're sitting when you're just breathing normally. So you seem to be straight up, you look relaxed while you're breathing, nothing like you're not struggling to get the air. You seem to not be using any accessory muscles such as your trapezius or your pectoralis major. And you're using the room air and you're not on oxygen, so that's good. Alright, so I did that. Now can you face that way for me, please?
Mm-hmm.
So I can have your back to. Alright, so now I'm going to, do you have permission to touch your back?
Yes, you do.
Alright, thank you. So I'm going to check your scapula. They seem flat, they don't seem like they're protruding or anything. I'm going to check your spine. It seems to be going down the midline. It seems to be straight, not crooked or anything. Now I'm going to check your ribs down here to make sure they're going at a 45-degree angle and they feel good. And now I'm going to take your AP transverse ratio. So I'm going to check here. So that's 1, and then to 2, which is in normal range, so that's good. And now I'm going to check your chest expansion when you breathe. So I'm going to go down here. I'm going to pinch some skin here. Can you take a deep breath in and out? Everything seems to be expanding symmetrically, so it's all good there. So now I'm going to check your breathing on your back. So can you take a deep breath in for me on each one and a deep breath out for me on each one?
Yep.
Every time it moves? Thank you. Breathe in. Again. 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 Can you lift your arm for me, please? Thank you. Again. And same thing on this side. Again. Perfect. Thank you. I didn't hear any abnormal sounds such as crackling, wheezing, weak breathing, or yeah. That's okay. And then, so now I'm going to move to the front of you. And I'm going to check your, do I have permission to touch you over here?
Yes, you.
Alright, your clavicle, I'm going to check those, and they seem symmetrical and even. I'm going to check your sternum, it seems flat, it doesn't seem to be protruding or anything. And now, I'm also going to check your breathing on this side. Perfect. Can you take a deep breath in and out for me? Thank you. Again. 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 Can you lift your arms for me, please? Thank you. Again. And then on this side again. Thank you. It's the same on this side. I didn't hear any abnormal diminished breathing. I didn't hear any crackles or wheezing or like, yeah, all good there. And then, so after that, can you lay on your back for me, please? So I would put a blanket over down here to make sure that I'm covering everything there. And then I would put a gown over your chest. So the first thing I'm going to do is I'm going to check the contour of your abdomen. So I got to get down at eye level for that to look. And it looks flat there, and it doesn't look like there's any abnormal bumps. And the color of it looks tan. No discolorations there. And now it looks symmetrical. His umbilicus is in the center of his body, and it is inverted. I don't see any lesions. So, yeah. So now I am going to auscultate. You're starting in your right lower quadrant, which is going to be below your umbilicus on your right side of your body. So I heard all the normal gurgles in there, and you're supposed to hear between 5 and 30 every minute. So I'm checking that. And now, have you had any abdominal pain?
I have not, no.
Happy for that.
Me too.
Yeah. So now I'm going to feel around on your body to make sure everything feels there. So I'm going to start here. Do I have permission to touch your body?
Yes, you do.
Before I touch you?
Yes, you do.
Thank you. Does it feel tender there? How about there?
No.
Any tenderness here? Right here? I didn't feel any abnormal bumps or anything there either. So now I'm going to check your urinary bladder. So I'm going to feel here. It doesn't feel full, it feels empty, but I can see it's in good shape. And so can you sit up for me, please?
Yep.
Okay, so I'm gonna check your kidneys now. Do I have permission to touch you?
Yes, you do.
Thank you. Do you feel any tenderness there?
No, sir.
On that side?
No, sir.
Awesome. So you're all set, thank you. So now for the closing, I would get him new clothes and linens. I would raise the bed rails by 2, and then I would make sure his call light is close to him and all his items are close to him. And then I would chart down everything I had. Perfect.